Hi, I am Danielle Vonfeld, a registered nurse at Hayes Medical Center in Hayes, Kansas. I want to talk to you about a catheter ablation. A catheter ablation is a way to treat irregular heartbeats or arrhythmias such as atrial fibrillation, atrial flutter, or supraventricular tachycardia. It destroys the tissue that causes your heartbeat to disrupt signals and get off course. This creates scar tissue inside your heart. This scar is a good thing and helps keep your heartbeat to stay in rhythm. Your cardiologist will not have to cut open your chest to do this procedure. We use catheters to go through the vein in the groin. A catheter is a long, flexible tube that guides up to your heart. We use energy sources to create the scar tissue, such as radiofrequency waves, laser, or cryotherapy, which freezes the tissue. The day of the procedure, you should not have anything to eat or drink after midnight. You will be instructed prior to your procedure on if you need to hold any medications, including blood thinners. You will also receive general anesthesia for this procedure and go to sleep. Side effects of general anesthesia may include nausea, dizziness, forgetfulness, and fatigue. You will be shaved from your chin to your thighs for this procedure, and we use lots of monitor patches that hook up to multiple machines to monitor you during the procedure. It is not uncommon for ablations to last anywhere from 2 to 6 hours, depending on what type of abnormal heart rhythm you have. When you wake up, you will go to the recovery room and wake up fully from your anesthesia. You will stay the night after your ablation, but should be able to go home the next day. You may feel sore, especially in your chest or groin area where we got access into your vein for a few days. It can take several weeks for the work done during your procedure to turn into scar tissue. Your heart rhythm may return to AFib or another abnormal heart rhythm until the scar tissue forms. This doesn't mean your ablation failed. You also may be sent home with acid reflux medications. You may need to take blood thinners after your procedure. Sometimes the ablation needs to be repeated. Do not push, pull, or lift anything heavier than 10 pounds for a few days after your procedure. The area in your groin may be bruised, but that bruising should not develop any hardness under the skin. There will be a stitch used to close your vein, and it is important to keep a close eye on your incision. You may shower the next day and remove your dressing. Make sure your surgical wounds stay clean and dry. Shower daily and replace a clean Band-Aid on your site for the next 5 days. No need for any lotions or powders. If you notice any signs of symptoms of infection of your incision, such as fever, redness, heat, or swelling, please call the cardiology clinic. Questions or concerns, call the DeBakey Heart Institute at 785-625-4699 or Hayes Med 1 call at 855-429-7633. Thank you.